So I'm a board certified psychiatrist, and I've helped over 250 PMHNPs and FNPs gain clinical confidence in their psychiatric diagnosis skills, treatment skills, and actually helping their patients get better and helping them make more money in the process. So in this video, we're going to be covering psych documentation. And this is an interesting topic for me because I was one of those people who never really cared that much about documentation. Like whatever, it's just like a necessary evil. Like who cares? People just overthink it. That's just my like type B type of personality. And so then I started PMHNP coaching. And so what I realized is that a lot of people actually have anxiety about documentation. Like they wonder that, okay, am I doing this right? Or, what if this is wrong? Or like, what if I get sued? Like things like that. And then I started realizing that, oh, okay, like this is a concern. And so I wanted to address that. So what I'm going to share with you is how I approach documentation as a psychiatrist and how you can approach it to reduce the burden of it and the workload and the stress you feel from documentation as much as possible. So let's get into it. The first thing I want to cover in this video is who documentation is for. So a lot of people often forget like the purpose of documentation, and I think that documentation has 4 purposes. So purpose of documentation. So number 1, it's for you. Documentation exists just as notes for you to remember. So that way you see the patient a month from now, you're like, okay, wait, what medication were they on? Or is the patient's son's name Billy or Jack? Okay, like what have they tried before? What's their diagnosis again? So it's that way when you see that, you can go, oh yeah, this is the reason, or this is what's going on. So then you can proceed from there. That's it. And because it's that, it's just think of it like notes for you. It doesn't have to be anything fancy. That's the key here, is because it's just for you. It just needs to exist so you remember how to do it, or you remember what happened. So that's number 1. Number 2, for other providers. So I've seen documentation that is super long. For example, I remember I used to work on the consult service. And so being in the consult service, I would have to read medical team's notes and sometimes neurology's notes and things. And I found the best notes were the ones that were just like succinct and to the point. And they were like, okay, saw the patient, they have this problem, we're doing this thing. That's great. The worst notes were when they were just like this long, flowery prose full of stuff. And I would find myself going through this and be like, oh my God, dude. And I would just go straight to the assessment and plan. And then now talking with my other colleagues, I realized that that's the complaint they had about psych notes. So like, yeah, your notes are like a novel. And half the time I just go the assessment and plan. Like let's say we as psychiatry consult service, we consult on a patient and we're like, okay, whatever, they have all this problem. Okay, we recommend starting Zoloft 50 milligrams. So they're just going to go to that, see that Zoloft 50 milligrams, like, okay, boom. And then they start the Zoloft 50 milligrams. They don't even read all that stuff because it doesn't help them. So remember that your documentation does not need to be expansive. It does not need to cover each and everything that was talked about. It does not need to have perfect writing and like literary level prose because no one's going to read it. The documentation only exists for you to remember, for other providers, so that way they know what the plan is or they can see what was done quickly and then use that information from there. So they only need the actionable information. They don't need all of the flowery prose or like all the things that the patient said in fancy quotation marks. Like none of that is needed. So there's that. Then the third reason is for insurance. So basically, your documentation has to prove that the patient was treated for X or Y diagnoses and that those were valid diagnoses. That's it. Because basically, like let's say you say the patient has depression, anxiety, and so you bill for that, and then you bill for a 99214, which means it's a moderate level treatment plan, and you bill for psychotherapy, and you had this intervention, and you spent like 30 minutes with the patient. That's all it needs. So all it needs to say is that, okay, The patient has depression symptoms of SIGE CAPS, assessment, depression, plan, Zoloft 50 milligrams, psychotherapy, 20 minutes of psychotherapy was done in the visit. And that checks off the requirement. Okay, they have this diagnostic criteria and there's treatment and this intervention was done. So that justifies the medical necessity of the visit. And then, okay, therapy was done. Okay, so put that in there. That's it. Like, they're not trying to read the note and understand all the details about the patient. They just want to know that, are you billing appropriately? And because they want to save money, they're like, okay, as long as the provider is billing appropriately, then we will do the payout. So that's what they're checking for. So as long as you have meet those minimum requirements, that's it. And then the last thing is legal protection. This is where you document your actions and the clinical reasoning behind them. So that way, heaven forbid, any kind of lawsuit or problem occurs with the patient, then you are protected in that you have written down that you followed standard of care. That's it. For example, like, let's say the patient's on lithium and they don't do their labs and they end up having a crisis. You can say that, okay, we placed the patient on lithium, counseled on doing labs, patient did not do lab, and then patient did not do labs, they continue the medication and they end up having a crisis. So that protects you because you told the patient go do labs to do this, and the patient did not. Or let's say the patient says, oh yeah, I had this side effect and you didn't tell me about it. But then all you write, right? Like, risk benefits discussed, side effects including XYZ discussed with the patient, and that's it. So you write that. Or let's say you do something like standard of care or not standard of care, like you use, for example, you might use clonidine to treat ADHD. So you write, okay, off-label use of clonidine, patient agreed to it, discussed with patient verbalized agreement, something like that. So all it does is basically, okay, legal protection. That's it. So once you realize the core needs of documentation, you can cut out all the BS. You don't need a whole flowery HPI that summarizes the entire patient's history. You don't need knowledge about their mother, grandmother, and all of this, because you don't need to spend hours on documentation when 5-10 minute note might do. I remember when I was in my third year of medical school or residency, I realized this. And so when I would be seeing patients, I would be typing as I would see the patient, and I would type in bullet points like, okay, patient came in with, okay, anxiety, increased stress level. Okay, Zoloft worked somewhat, side effect of nausea. Like, I would write in basic jot form points, and then assessment and plan. So assessment, side effects happening, plan, continue current dose. Don't increase at this time. Like, that's it. I would write very simple because I wanted to prevent burnout, right? I didn't want to spend all day doing fancy documentation. Whereas one of my colleagues, he's more like a neurotic type, and he would be sitting there hours after the clinic and just trying to get his notes. And I would look at his notes and yeah, sure, they're perfect, but this is an outpatient clinic. Like, no one else, you're the one taking care of the patient. Only you're going to read the note. Probably no other provider is going to read it because now, they're not involved in the care. Or even if you send it to the PCP or whatever, it's so long, they're going to groan, right? Insurance doesn't really need all that information. And yeah, you just need to put basic stuff in your legal document protection. Sometimes if you put in too much stuff, it can go against you if you put in too much information in the legal aspect. So that's it. Does not need to be perfect. No perfect. Serviceable. So once you remember that's the core need of documentation, you can just take out all the overthinking and all the other stuff, because this is the whole purpose of it. And once you remember that, you can just focus in on that, so you can actually focus in on the patient care aspect that matters. Because to do this, when you adopt this attitude that no, it's not just going to be perfect, that's when you can decrease your burnout. So I remember I worked in the emergency room, and I remember one of the worst parts about it was documentation. So we do risk assessments for kids that would come in, and then afterward, I'd have to do the note for the hospital. And it was the note was imagine a mental status exam where instead we're just typing it in or just checking that everything is normal, you have to go through each and every bullet point of each component of it and radio check it. And they had so many other things and so many other components of this documentation, to the point where it took just as long to do the note as it did to see the patient. And I was like, dude, there's no point of this. Because remember, as a provider, you only get paid for seeing the patient, especially if you're in an outpatient kind of model or like an RVU model. You don't get paid for doing the documentation. So you want to make it as easy and efficient for yourself as possible so you can A, make more money, and B, so you can protect your mental sanity. And one of the ways that I found to do that, this is just like an add-on, is just use an AI software. So in my private practice, I have an AI software that basically just does my documentation for me. The template's already set, it's already pre-made. And so all I need to do is I'll see the patient, it will record it, and then it will make or audio record it, and then it'll make a template based off of that. And like, boom, I just copy paste it, maybe switch like one or two little things, but it works pretty well. And now I save hours on my documentation. I'm not documenting as I'm typing or as I'm seeing the patient. I can just literally focus on the patient, let AI do the work. So it's been huge to help me with burnout purpose specifically. And because I remember the whole purpose of documentation, I can just get the essentials done without all of the extra fluff and the things that cause stress. So I hope that this has been helpful. And if you want to learn actual practical tips like this on how to be the best psychiatric clinician you can be and how to use these skills to help make more money for yourself, best way to do that is in our PMHNP and FNP coaching program, where we had over 250 students go through so far and really start mastering their psychiatric skills. So you can check that out. And